Okay, let's talk about something huge. A health condition that up to 80% of women will face by the time they're 50, but so many suffer through in silence. We're talking about uterine fibroids. And for millions, this isn't just a medical term. No, it's a daily battle that can honestly take over your entire life. Just listen to that. My life was a complete nightmare. And you know what? That's not an exaggeration. That's not hyperbole. For so many women, that's the raw, honest truth. It's a reality for people whose stories get dismissed or just misunderstood. So today, we're going to get into the real impact of this. Yeah, so if you've ever heard this condition dismissed as just a bad period, let's be crystal clear. That doesn't even come close. The toll it takes physically, socially, emotionally, it can be absolutely devastating. So this is what it actually looks like in real life. We're talking about constant, heavy bleeding. And I mean heavy. They call it flooding for a reason. Imagine having to know where the nearest bathroom is at all times. Imagine debilitating pain that just forces you to put your entire life on pause. It's no wonder it leads to social isolation, to losing intimacy. You're living in a state of constant anxiety, always planning your life around this condition. And then, to top it all off, you go for help and you feel dismissed. It's just a lot. Okay, so now that we've felt the human side of this, let's take a step back. What are we actually talking about, medically speaking? What are uterine fibroids? So the technical term is leiomyomas, but basically, uterine fibroids are growths made of smooth muscle. They can pop up in or around the uterus, and here's the most important thing to know right off the bat. They are benign. They're non-cancerous. That's absolutely key. Now, get ready for this number because it is staggering. Somewhere between 40 and, get this, 80% of women will develop fibroids at some point. Let that sink in. This isn't some rare, obscure condition. It's incredibly common, a major public health issue that we just don't talk about enough. And because they're so common, you've probably heard a lot of things about them, and not all of it is true. So let's bust a few myths right now. Myth number 1, that all fibroids need treatment. Nope. Fact is, a lot of women have them and don't even know it. They're totally asymptomatic. Myth 2, that a hysterectomy is your only choice. Absolutely not true anymore. There are so many uterus-preserving options now. And myth 3, that they grow slowly and predictably. Turns out that's not right either. Research shows they often grow in these totally unpredictable spurts. Okay, so for the women who do have symptoms, what does that actually feel like? Well, the biggest one is that heavy, prolonged bleeding we talked about, which can get so bad it leads to anemia. Then there's the severe cramping and pelvic pain. And doctors have this term bulk symptoms, which is basically this feeling of heaviness, this pressure on your bladder or bowels. That's what causes things like having to pee all the time. And for some women, it can even create challenges with getting or staying pregnant. All right, now we need to talk about something incredibly important. Because when we talk about who gets fibroids, well, it's not an equal playing field. There is a huge and, frankly, deeply concerning racial disparity at the heart of this whole story. And the numbers here, they speak for themselves. This is from a study of young women, 18 to 30 years old, who didn't even have symptoms. And look at this. They found fibroids in 26% of the Black women they studied, compared to just 7% of the white women. The takeaway is just undeniable. Black women are hit harder, they're hit younger, and often with more severe symptoms. Which brings us to the million-dollar question, right? Why? Why on earth does this huge disparity exist? Well, the answer isn't as simple as just genetics. Researchers are finding it's this incredibly complex web of factors, things like chronic stress. There's this concept called allostatic load, which is basically the biological wear and tear on your body from constantly dealing with things like racism and socioeconomic disadvantage. Then there are environmental exposures. For example, studies have found links between chemical hair relaxers, which are used more often by Black women, and a higher risk of fibroids. And then, of course, there's the history of bias in the medical system itself, where symptoms might get ignored or a diagnosis takes way too long. So when you put all of that together, the physical pain, the systemic issues, it's not surprising that it takes an absolutely massive toll on a person's daily life. And this right here really puts it all into perspective. I want you to look at this comparison. Studies have actually measured the impact on quality of life, and what they found is just, wow. Symptomatic fibroids can have a similar, or in some cases, worse impact on your quality of life than heart disease, diabetes, or even breast cancer. For anyone who's ever felt like their pain was being brushed off, this is the data that says no, what you're feeling is real and it is serious. And it's not just a physical thing, not by a long shot. The constant pain, the unpredictability, it takes a huge mental toll. I mean, look at these numbers. One study found 61% of women with fibroids had borderline or clinical anxiety, 35% for depression. This is proof that this condition attacks your peace of mind just as much as it attacks your body. And this quote from Catherine, it just says it all, doesn't it? I became a virtual recluse. Just think about that for a second. You lose control of your body, and then you start to lose control of your life. You can't make plans, you pull away from people. It's a kind of isolation that's just so profound. But here's the good news. This is not where the story ends. Far from it. The whole narrative is shifting away from just silent suffering and towards empowerment, towards reclaiming your health. And that's all thanks to the fact that there are more and more effective treatments out there. And the path to getting better isn't a one-size-fits-all kind of deal. It's really a spectrum of options. You know, for some, it might start with just managing symptoms with medication. If you want to preserve your uterus, there are surgeries like a myomectomy where they just take out the fibroids. There are even less invasive things like ablation or embolization that shrink or destroy them. And of course, a hysterectomy is still the most definitive way to stop the symptoms for good. But the most important thing is you have choices.
And this is why having those choices is such a game changer. Look at this transformation. Researchers looked at dozens of studies, and on a 100-point quality of life scale, the average score before treatment was around 47, okay? Now look at the score after treatment. It jumps to over 80. That's not a small bump. That is absolutely life-changing. This is the proof, right here in the data, that there is a real path back to feeling like yourself again.
So that brings us to the big question at the end of all this. When you look at the whole story of uterine fibroids, the way symptoms are dismissed, the shocking racial disparities, the long fight for treatment, it all really points to something bigger, doesn't it? It makes you wonder, are we as a society, as a medical system, are we really taking women's pain seriously enough? That's a question I think is worth sitting with. Thanks for joining me.